Dr. Kempton, thank you so much for joining us today in a
My
recorded
pleasure.
format. And I wanted to start off our conversation just by hearing about when you started Mass Eye and Ear and what your role is at Mass Eye and Ear.
Right. So I had started my career at Hopkins for about 7 years, and then at Penn for about 10 years. And I had decided to pursue an international development work like what I'm doing now at that point. And so I had thought at first that would come to pass under Penn, but it sort of ultimately worked out better to come to Mass Eye and Ear that had sort of a broader vision about global health and the idea of having someone who's a full-time faculty member being overseas most of the time, which I think is almost unprecedented vision. So I switched over to Mass Eye and Ear at the beginning of 2017. So it's a little over 3.5 years now. And my role is to sort of carry on this international work. And then I also have the title of Director of Epidemiology, sort of based on my sort of career-long focus on clinical epidemiology and having been for a while the editor of Ophthalmic Epidemiology and so on.
So building on that, I'm interested to hear a little bit more about what your work's like now in Ethiopia. So what is the balance of your day? How much time in the year are you there? And what things are you involved with?
Yeah, so the way it's worked out is my colleagues and I started a charity called Sight for Souls to try to pursue this vision. It's a Christian charity and seeking to see about whether this cross-subsidization model can work in developing countries. So this is our first site. And so I spend a fair amount of effort in trying to plan that, you know, and writing grants. Like we recently have been awarded a American Schools and Hospitals Abroad grant through Mass Eye and Ear. When we came in 2015, there was only one fellowship in this whole region in all of Eastern Africa and in retina, actually, in Tanzania, which was left over from an Australian missionary that had been working at Kilimanjaro Christian Medical Center and had done a good job of training, and then his trainees have been able to continue that program. And then there has been a pediatric ophthalmology one on and off, but that has faded out now in Tanzania. And then so now I'm doing a uveitis fellowship, which is still needing some formalization, but I've been doing sort of part-time training here for about almost 2 years, so the trainee is nearly trained. And Scott Lawrence, my partner with Ethiopian colleagues, has started a glaucoma fellowship also that's mostly at a public hospital. And then the oldest public hospital also has gotten approval to start a glaucoma fellowship. So Ethiopia is kind of making some good advance in this area. Not that much time doing clinical work because I'm still doing a huge amount of research. And I don't want to be seeing like dry eyes and displacing competent Ethiopians from doing that kind of work and sort of upstaging them. So and they're quite capable there. And so I'm mostly doing uveitis subspecialty practice and training, and it's the only uveitis subspecialty practice that I know of between Egypt and South Africa.
And you did have a resident visit you last year, correct?
Yeah, so Edith, who I think came out to visit us, and she's working on a project, but we've been sort of waiting for the data to accumulate, you know, so she hasn't been doing that much, but she'll come back to it when we are ready to write it up about lower lid trichomonas trichiasis, which has not been published very much. Okay, and I hope for all of you medical students that this will be interesting. I think what I'm doing is unusual, but maybe other people will increasingly do this as time goes on. Hopefully it's a way for American medical faculty to be involved in development, which I think is often kind of difficult because of expectations about raising your funding.